again, my name is Izzy. I'm a medical assistant with Mercy Southeast. Awesome. So what is a medical assistant? So we work in clinics such as orthopedics, specialization, things like that, or we can work in more like primary care, which is also very fun. I prefer not to do that because I like ortho. Basically, our job is to help groom the patients, get them where they need to go, help the doctor with any type of procedures, anything like that. And of course, we're just kind of there to help communicate what the doctor wants to the patients, which is also a very fun part. And of course, scheduling procedures, putting in orders, making sure everything's right, taking phone calls, things like that. Phone calls are probably my least favorite part of it. So, of course, like I said, we work in outpatient clinics. I have worked in orthopedics and I have worked in community care. So if you've ever been to the Southeast Community Care, that is where I've worked sometimes. 2 different roles there, especially with doing things like orthopedics, which I don't get to do a lot of things there. I get to help with the procedure, but I'm not the one getting to do everything. But in the more primary care or community care side, there's a lot more things that you get to do, things like ear flushes, which are kind of gross, and like kind of different things like that.
It's gotta be satisfying though, like when a big clump of earwax comes out, the person can hear better, like.
Sometimes.
Probably, yeah, gross would be, yeah.
It's a little gross, for sure, but I mean, it's nice to know that you're helping a patient, and they walk in, can't hear you, and then after you're done, they can hear you again, so that's definitely a fun part. So things that we can do. With working in ortho, I get to do blood draws a lot. We do a lot of orthobiologics. Those are which the one that we do is where we draw blood, spin it to get the platelets, and then inject that back into a joint, a tendon, a muscle, or anything like that. Helps healing process, and it causes inflammation. And that's mostly the one that I get to do out there. The injections are more going to be that primary care, community care. I get to do a lot of injections, so if you've ever had a steroid shot, I'm the type of person that would give it to you. Glucose monitoring, and I'm sure if you've taken the anatomy, you've done that, right?
Some of these have.
Okay.
Yeah.
Of course, assisting in procedures, so the doctor that I work for specifically, I help him with a lot of keeping the field sterile and things like that. And then, of course, patient education. Patient education is something that is super important as a medical assistant. You have to know a lot of things because you're that primary conversation to the patient. Doctor's in there for 5 minutes, like most of you probably have experienced. So most of your conversations are going to be with your MAs, your LPNs, things like that. And that's just a little list of things that we do get to do. So to be an MA, I went to CTC. I did the 8-month program. It was a full-time, so you were in person Monday through Friday, 8 to 4:30. But there is also an online option. That takes about 6 months to complete. You got your own pace. So you can kind of just choose which works best for you. Of course, if you go to school, you want to be able to work to pay for it. Or if you go online, then you kind of just get to make your own pace with that. My experience with being an MA, I was 18 whenever I became a registered medical assistant. I graduated early from here. I graduated in December of 21. I went right into the medical assistant program in January, and then I graduated in August. So by the time I was 18, I was already working in a clinic, and of course I've worked in orthopedics since then. That's where I chose my home. Of course, like I said, I've looked to community care a lot because they need more medical assistants out there. The subspecialties that I work in with orthopedics, so sports medicine. So any of you athletes? Maybe? Okay. I mean, band counts. Is anybody in band?
Band?
Hey, there we go.
Band.
Okay.
They
So
just got
band
back
counts, I
from the
promise. So we take care of a lot of our athletes. We are with SEMA specifically, so a lot of our SEMA athletes that get hurt on the fields or anything like that, we take care of them. We get to do, and then of course our doctors go to like their meets and things like that to help there. Unfortunately, I don't get to go because I'm not as useful. And then I worked in pediatrics. Ortho pediatrics is not very fun because you get to see a lot of babies cry. But I worked in it for about 2 months. Really fun to see kids. They thrive after a broken bone. It's super just cool to see that, personally, which is also why I've got a dinosaur badge reel. And then specifically right now, I'm working with the shoulder specialist. So we do a lot of shoulders, like arthroscopes, which is where he goes in with a bunch of different scopes to see like the rotator cuff and things like that, figure out debridement, fix the muscles. Kind of fun, but it gets boring after a while. I will promise you that, which is why my home is more of that sports med, because you get to deal with the whole body, you get to deal with athletes, young people, old people, injections. It's very fun. Okay, cool. Why I would recommend for anybody to start out as an MA if you're wanting to go into the medical field. I'm sure most of you do want to go in the medical field. Is that correct? Head nods? Okay. Does anybody know where they want to go right now? No? Anybody do? For sure? You? No. So if you're starting out for like RN, this would be a great stopping point just because you get to learn so much in a short amount of time. You can find your specialty of what you really like to do, and you get to hit it and hit it hard, especially if you work in that. So for me, I want to end up as an NP. I want to stay in ortho, be an NP in ortho. So get to learn a lot about bones, which is fun.
Tell us about MP.
So nurse practitioner.
Oh, I thought you said MP.
No,
It's like,
NP.
okay, gotcha.
So I'm going to nursing school right now. I'm in the College of Nursing also. So this was my stopping point so that I can learn a little bit more before I get full blown into nursing. Of course, it gets you into healthcare very fast. It takes 8 months, 6 months if you do the online, which I wouldn't really recommend that. I have one of the girls that works in our clinic did that. She's a little bit more lost than most of us, but she's still doing great, so I wouldn't not trust her. But like I said, it takes 8 months. They start in August at CTC. They go August to May, I think. So in that time period, you would learn a lot. You would go to different clinical sites. You would learn phlebotomy. And so if any of you are wanting to do anything like that, you would be able to start in whatever specialty you would like. If it's primary care, orthopedics, OB, things like that. Of course, that was my next point, is that you can specialize into anything that you want, and it's just a great education. You learn a lot about the human body, and whenever you do get into that specialty that you love, you get to learn a lot more about it, which is kind of why I'm ending up in ortho for sure. And it's just a great starting point, especially if you don't know where you want to go. Like people usually go to like CNA, kind of go to the hospital, things like that. But this is more in-depth about the body. You get to do more things. You get to do injections, draw blood, which is super, super fun. But yeah.
So you can do that as an MA. You don't have to be an LPN to give injections.
Yep.
Okay.
So we are below LPNs in the sense that we cannot work in the hospital, but our education is pretty similar. But it's not super in-depth with like medications and dosages and things like that.
Tell me what you mean by you can't work in the hospital.
So we don't have the licensing to take care of a patient as a nurse, basically.
Gotcha.
The main role for us is to work underneath a doctor.
Gotcha.
If you ever try to look up a scope of practice for a registered medical assistant, you won't find one.
Okay.
That means that we basically have to know what to do, and the doctor either has to show us how to do it, or we better know how to do it whenever he asks us to do it.
Okay.
Which is kind of fun, because then you get to do a little bit more than what you think.
Yeah. So like, have you been in surgery and stuff like that? Or?
I did get to go watch surgery.
Okay.
I'm not allowed to go and like help with surgery, but I wish I could. That'd be super fun. But that's why I'm going to RN and NP, so I can.
So that's where your eventual path is going to take you into basically being a nurse that helps with surgical procedures.
Yes,
then?
a firsthand.
Cool.
Yeah.
All right.
I didn't really ask any of y'all, what grades are y'all in? Sophomore, junior, sophomores, juniors, any seniors? Okay. So seniors, I would recommend it, especially if you're really wanting to get into healthcare, unless you know what you're gonna do. If you know what you're gonna do, stick to it. But if you don't know, then I would really suggest it. And then even my sophomores and my juniors, it would be something good to look into because you can start it as soon as you're 18. So you can start that online course and you can do it through high school. So if you turn 18 in August and you have that whole year of school for high school left, you can get that done and start as an MA. So, anybody have any questions? Yeah.
So ballpark, like, not, you don't tell us yours, but like ballpark, what is an MA usually do, like hourly, like money-wise, like?
So it can range. Right now, the minimum at the hospital is 15 an hour.
Okay.
Because I've been there longer, I'm making a little bit more than that.
Gotcha.
Just because I stuck with them. St. Francis, I know they're getting closer to that 18 range. In St. Louis, I'm even seeing like 20s,
Yeah.
which coming out at 18 and having a job as an MA and making that much money,
Yeah.
like I'm not making too much more than that 15, but I was able to still buy myself a brand new car. So if that puts that in perspective for any of y'all.
Okay.
But yeah. You guys have any questions?
Give us like some typical things that you would do like today or yesterday, like what did your day look like?
So today I was with sports medicine. So we saw a couple athletes for like ankle sprains, some fractures, some different like little stuff. Sports medicine is also like a flip side also. So we get to see a lot of old people with like arthritis, osteoporosis, things like that.
That's pretty big range.
Yes.
Going from young, really healthy people to old,
Yeah.
less than healthy.
That's pretty much what sports medicine is. You either get the very young people who are athletes or the very old people who just have really bad bones.
Yeah.
And then on a day like yesterday, I was with the shoulder surgeon, Dr. Baker. And so that's mostly your middle-aged, just because that's whenever your bones do start to kind of deteriorate if you're not a very healthy person and they get ahead of themselves, tear the rotator cuff, need surgery. And then also a little bit older with like your your arthroplasties, so total replacements. I don't mess with those a lot. We have a nurse navigator who does that.
And so you worked in, you said, like convenient care, and you've worked in orthopedics. Have you worked in other avenues, or mainly just those two?
No, mainly just those two. I'm trying to think of my other rotations that I did.
So as part of your schooling, you did some rotations
Yep.
then?
So we do rotations in primary care, phlebotomy. We didn't do a rotation in ortho. I just landed in ortho for my, what's it called? Like the 4 weeks that you get to go out to the job and you do that job for 4 weeks.
Okay.
Internship.
Yeah.
Trying to think of any other places that I went. We mostly went to primary care, and then phlebotomy.
So,
I need a custodian in the main office, please. A custodian in the main office, please.
so most, like most doctors' offices outside of a hospital setting would employ an MA, like, or have several of them ready
Yeah,
to.
absolutely. So there's only 3 of us right now. We've got orthopedics is a little different. We have athletic trainers, which they go to school, they get their master's degree. They're the people on the sidelines that are with the student athletes all the time. But we do employ those also. And we also have patient partners, which would be good for anybody who likes ortho and wants to start out, because you don't need any education to start as that. There are clinical and administrative staff that help us room patients or help us do more of that, like check-in, insurance things.
Okay.
Yeah. So there's plenty of options in ortho if you ever want to end up there. We would be happy to have you. So yeah. Anybody have any questions? Okay.
Let's see. You're gonna kind of tell us about your different like experiences school-wise.
School-wise, yes.
Yeah.
So I have been to CTC, I've been to CMO, and now I'm at the College of Nursing. If I had to pick one out of all of them that I love the most, it was most likely CTC. CMO was not my favorite. I didn't like being in a classroom all day. Didn't like having full schedules. There's just too many people. College of Nursing, on the other hand, all of my classes have been online currently. So
Good.
I had AMP2 online. They gave me a box of animal organs to take home and dissect. Yep. I had a fetal pig, a pig kidney, a cow heart, a sheep brain, and a cow eye.
Here's a pack of organs.
Yep.
Get to work.
Yep, that's exactly what they said. So, and those, your SEMA classes are going to look much different from your college of nursing classes. So in one semester, there's 2 sessions. So you might remember back to like 8th, 7th, 6th grade where you had 4 different terms. I know that's how I was. I don't know if they changed it after I got out of here. They changed a lot. So in each semester, there's 2 sessions. So you have 8-week courses instead of 16-week courses. So you hit the ground running on that first week. There's no syllabus day and this and that like SEMO does, or like a syllabus week. But yeah, I like the College of Nursing the most, or CTC, just because they're technical, they're on hand, they're hand-on, and things like that. Or of course, if anybody wants to be like a CNA, I have that experience too. Wouldn't suggest it, but it was also fun. If you like old people, it'd be really fun.
So kind of like give us a comparison of the 2 CNA versus MA.
Okay. So
What's your point?
yeah. CNA, you're gonna, it's not very fun, but you basically clean patients and that, and
You wipe a lot of butts.
yes.
Okay, got it.
In a nursing home compared to the hospital, which I've done both, nursing home, it's a lot of take this patient to the bathroom, get them showered, do their laundry, help them clean up, things like that. Hospital is more acute in the sense of there's a lot more things going on. So still the same thing, but you do vitals. I worked the surgical floor in the cardiac unit. So cardiac unit had like chest tubes, so you had to monitor those sometimes, make sure that there's not like straight blood coming out of them. And of course you always report to the nurse if that happens. But the surgical floor, which is where all the ortho patients ended up after their totals and things like that, it gets a little hectic because you have to do constant vitals on them to make sure, because they're coming out of that post-op. So they go to the recovery, but then they come to you, and of course the nurse too. But you got to monitor them a little bit more because they're coming off of anesthesia and things like that. You're the one that's in there the most. You would think your nurse would be, but it's actually going to be your CNA. But yeah, I would suggest it for anybody who wants to just kind of have that hospital experience. I had it, it was great. But also MA was probably the best place for anybody to start, especially if you don't know where you want to go.
Does Mercy help you pay for school at all, or no?
No. I can give you
Well, that's not merciful.
No. So if I go to so now that I'm at the College of Nursing, since I am employed by Mercy, I do get 20% off my tuition. That doesn't include books, and your books are going to be expensive. I have my psychology book, which was $400.
For a psychology book?
Yes. A psychology book.
Ooh, that's awful.
But I can give it to my friend who is also going through the program with me, since she takes psychology in the summer. So she gets the benefit of me having to pay $400 for a book.
You can sell it to her for $300?
I could.
Yeah.
But for CTC for my MA, it was roughly $5,600, and that's full time. It covers your books. Doesn't cover any scrubs. You have to buy your own scrubs.
Did you do A+?
I did not.
Did not, okay.
So I should have.
Would A+ have gone toward that, or?
I'm not sure.
Okay. No, not very
But and then also at CTC they have the LPN program. You can do the 1 year, the 2 year, and then the RN program at the College of Nursing is a 2 year and a full time, or a 2.5 year part time, which is what I'm doing. So I have my MA, so I can only work certain hours because our office is only open on certain hours. But for my RN classes that start in the fall, they'll be at 4 o'clock or later and on the weekends. So I'll still be able to work mostly full time. And
That's gonna be a rough schedule.
just a little bit.
Like work all day and then go to school all night.
Yep.
God bless you.
Well, in high school, whenever I was a CNA, I worked at the Villas of Jackson, and I was a night shift CNA. So
Yeah,
you didn't have me by that time. I was already long gone.
yeah.
So I made it work just because I loved what I did.
So did you do CNA like at the CTC while you were here then?
Yes, so I was, but then I graduated in December, so I couldn't keep doing it.
Okay,
And that's whenever I switched over to the MA program.
gotcha.
So
sorry, I've been grilling you with questions.
You're good.
I should
Nobody
make
else is asking
everybody
questions.
formulate questions, but I'm afraid then I'd have less people attend than I already do, and so I don't wanna lose people.
I will say, out of every clinic that I've ever worked in, been in, ortho is the most fun, for sure, because we're all either athletes that worked in health, that started in healthcare, or we all have like ADHD or something. Because none of us can sit still. We've got a PT room upstairs. It's a huge room, bigger than this, and we just get to. We've got. It's where we're supposed to take our athletes to see how they're like hitting or kicking and things like that. But we go out there and have fun and play games.
Alright.
So we need like a mandatory like hour lunch break to get all of our energy out.
Okay.
So ortho is very fun if you like bones and muscles, and if you don't know them, you'll learn them. I promise. Because those doctors, they grill ya.
Yeah.
The first time that I went and watched the surgery, I was at my last week of my internship, and the doctor that I was watching was doing a shoulder surgery, and he was like, "What's that?" I looked at him and I said, "I don't know."
Is a part of the shoulder.
I said, "It's a shoulder." That's exactly what I said. Because I didn't know. But they're super educational, they're super fun. So if I could recommend any specialty, it would be ortho. So, yeah. Anybody got anything? I'm gonna be like a mean teacher and start calling people. What do you think? Not actually do that, I promise.
Everyone's heart rate went up. Oh.
Just a little bit.
I'm gonna say words.
Well, if nobody has any other questions, I'm always happy to talk. If anybody does come up with anything, just let him know.
Okay. Perfect.
You're okay with that?
Yeah, I'm great with that. Thank you very much. Clap it up, everybody. I appreciate you coming in.
Yeah. Hope everybody enjoys their time in the medical field. For sure.
All right, did everybody that's in here, did everybody get a shirt? You get a shirt?
See ya.
See ya. Thank you again.